We're live. All right, Matt, you want to let everybody in?
Thing.
Good morning, everyone, and thank you for joining our weekly COVID-19 briefing. Today, Acting Health Commissioner Dr. Cheryl Bedegal will be joined by Mayor Jim Kenney. Due to the number of topics that will be discussed today, and to give the press adequate time for questions, today's briefing will run until 11:30. I wanted to take a second and welcome viewers who are watching today's briefing live from the Health Department's YouTube channel. As always, we will present remarks first in English, then in Spanish, and then open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and that we limit questions to 3 or fewer. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic of the COVID pandemic and the city's response. With those instructions out of the way, Mayor Kenney, can you please start us off?
Thanks, Jim. Thank everybody for joining us today. I think it goes without saying that none of us want to be here discussing restrictions and policies needed to stem the spread of COVID-19. With the continued spread of the Delta variant here in the region and nationally, we know we need to take some stronger steps to protect our residents. Our case counts continue to tick up and hospitalizations are also up slightly. So Dr. Bedegal will announce why we're implementing new mask mandates for businesses and events and a vaccine and mask requirement for city employees. The updated policies we're implementing are critical to slowing the spread of the Delta variant of COVID-19, which is more dangerous and transmissible than earlier forms of the virus. The science is clear. These measures will protect Philadelphians and save lives. We strongly urge everyone who has not yet received the vaccine to get it immediately. Please just get the vaccine. This could all be avoided if we just did that. And if you're due for a second dose, please be sure to get it. It's the best and safest way we can get through this deadly and unpredictable pandemic. We flattened the curve before, and we must do everything in our power to do it again. So now I'll turn it over to Acting Health Commissioner, Dr. Cheryl Bedegal.
Thank you, Mayor, and welcome everybody. Thank you for being here. So I continue to be concerned with the rise in cases and hospitalizations in Philadelphia. We have seen how quickly things can get out of hand with the Delta variant in other states. We're hearing from other cities and states that their hospitals are full. So full that there's a risk that someone with a heart attack or an injury may have to be taken to a hospital hundreds of miles away for care. We're not nearly to that level, but our average new cases per day have doubled 3 times in the last month. We're seeing nearly 200 new cases of COVID every day now. And for the first time since early June, more than 100 people are in the hospital in Philly with COVID. This is not the summer any of us imagined. We had hoped that our high vaccine rate, more than 77% of adults had at least 1 shot, and 63% of Philadelphia adults are now fully vaccinated. And our recommendation for folks to wear masks would slow this virus down. Unfortunately, that hasn't happened. As the mayor mentioned, today we're instituting a few new policies. I need to stress that these are just a next step. We will be watching the numbers closely. We may need to adjust safety measures if they continue to rise. First, we're instituting a mask mandate in Philadelphia starting tonight at midnight. That means that everyone in Philadelphia must wear a mask when going into any business or institution, with an exception for those that require vaccinations. Restaurants and bars will need to require masks for all staff and customers, except when people are seated and actively eating and drinking. If a business or institution is requiring that everyone, including staff, be fully vaccinated before entering, then no one in that place needs to wear a mask. So there is an exception for places with a vaccine mandate. Because of the high risk from COVID to seniors and those more vulnerable to high temperatures, we're requiring masks to be worn in the city's cooling centers. And that policy will start at noon today, while the citywide mandate will begin at midnight. We want people to feel safe going to our cooling centers. Additionally, unseated outdoor gatherings of more than 1,000 people are required to have everyone masked. In accordance with this policy, city buildings will require that everyone in public areas be masked. Again, that mask mandate starts tonight at midnight. The second thing that the mayor referred to is our new employee vaccine and mask requirements. On September 1st, all new employees hired by the city will be required to be fully vaccinated against COVID. Current employees will be required to either be fully vaccinated or to double mask whenever they're in an indoor space with others. By double masked, I mean that they need to wear a disposable paper mask or surgical mask underneath their cloth mask. By wearing both masks like this, research has shown that you'll be protected almost as well as with an N95 mask. So you understand what I'm talking about. I'm going to demonstrate how to safely double mask and why. So here is my paper surgical mask. I put this on, loops over the ears, and I pinch the nose. I've now pulled this under my chin, so I'm masked. But you can see that there's some little gaps here at the sides, right? So what the cloth mask does, I always have to check that it's right side up, is that it goes over the top here. It gives me those extra layers of protection, and your cloth mask should have 2 layers at least. And it makes this fit more tightly. It closes off those openings. So it does seem cumbersome, but luckily there is something else that you can do to protect yourself. You can get vaccinated. It's easy, it's free, it's safe, and it is extremely effective. The latest research shows that you have 1/8 the chance of becoming infected with COVID if you're fully vaccinated, and that's with the Delta variant. 1/8 the chance, and 1/25 the chance of ending up in the hospital from COVID if you are fully vaccinated. And again, that's with Delta. And there are hundreds of places throughout Philly where you can walk right up, you can get your vaccine for free, you don't need ID, and you can start protecting yourself and your loved ones today. Getting vaccinated isn't just a personal decision. It's a decision that affects all of us. According to our contact tracing staff, we know that 2/3 of the people who know where they were exposed to COVID report that it was because of a household member or a visitor to their home. That's right, people are catching COVID at home from someone who brought it into their house, typically a member of the family or a friend who wasn't vaccinated. By getting everyone who is eligible in your house vaccinated, you can help to protect them all, even those too young to be vaccinated. Now, before we close, I want to talk about one more COVID announcement. A lot of the things that we announced today require that you prove that you're vaccinated. We know that a lot of people have lost their vaccine card, or it's been damaged, or are worried about what that will mean if they need to prove their vaccination status. That's why today we now have an official way to request your immunization record. This process has taken a while because we don't want to give people's private health and vaccine information out to anyone that asks. But we now have the process to request your immunization record for COVID, which will show that you're vaccinated. You only need to call our COVID call center at 215-685-5488, or you can email covid@phila.gov. So again, covid@phila.gov or 215-685-5488. And that's if you've lost your vaccine card or it was damaged. Our staff will walk you through the process of verifying your address and figure out the best and quickest way to get your records to you. Finally, I want to say that things don't look great right now, especially in light of what we're seeing in other states. But I do believe that by getting as many of our friends and our loved ones vaccinated as soon as possible, by wearing masks when needed, we can show the rest of the country how to beat this pandemic wave. It's no secret how we can do it. Visit www.phila.gov/vaccine, find the nearest vaccine clinic, and get vaccinated. Tell your friends and your loved ones about how easy it was to get vaccinated. And if they or you have questions about the vaccine, any questions, there are no dumb questions on this, please call our call center at 215-685-5488. Thank you all for joining us today. Next, we'll have our remarks presented in Spanish, and then we'll open it up to questions.
Palabras del alcalde Jim Kenney para el 11 de agosto del 2021. Gracias a todos por acompañarnos hoy. No hace falta decir que ninguno de nosotros quiere estar aquí para hablar de las restricciones y políticas que son necesarias para detener la propagación del COVID-19. Con la continua propagación de la variante Delta aquí, en la región y a nivel nacional, sabemos que debemos tomar algunas medidas más firmes para ayudar a proteger a nuestros residentes. Nuestro recuento de casos sigue aumentando y las hospitalizaciones también han aumentado ligeramente. Por lo tanto, la doctora Bergo nos ha anunciado por qué estamos implementando una nueva normativa sobre el uso de mascarillas para las empresas y eventos y el requisito de vacunación y de portar mascarillas para los empleados de la ciudad. La normativa actualizada que estamos implementando es fundamental para frenar la propagación de la variante Delta, que es más peligrosa y transmisible que las cepas anteriores del virus. La ciencia lo dice claramente. Estas medidas protegerán a los habitantes de Filadelfia y salvarán vidas. Instamos encarecidamente a todas las personas que aún no han recibido la vacuna a que la reciban de inmediato. Y si le toca la segunda dosis pronto, asegúrese de recibirla. Es la forma más segura de superar esta pandemia mortal e impredecible. Hemos aplanado la curva antes y debemos hacer todo lo que esté a nuestro alcance para volver a hacerlo. Y esta es la actualización en materia de salud para el 11 de agosto del 2021. Seguimos preocupados por el aumento de los casos y las hospitalizaciones en Filadelfia. Hemos visto lo rápido que las cosas pueden salirse de control con la variante Delta en otros estados. Estamos escuchando de otras ciudades y estados que sus hospitales están tan llenos que existe el riesgo de que alguien con un ataque cardíaco o una lesión severa tenga que ser trasladado a un hospital a cientos de kilómetros de distancia para recibir atención médica. Quiero aclarar que no estamos ni cerca de ese nivel en Filadelfia, pero nuestro promedio de casos nuevos diarios se ha duplicado 3 veces el último mes. Por primera vez desde principios de junio, estamos viendo casi 200 casos nuevos del COVID-19 diariamente, y más de 100 personas están en los hospitales de Filadelfia con COVID actualmente. Este no es el verano que nosotros habíamos imaginado. Esperábamos que nuestra tasa de vacunación, que era tan alta, con más del 77% de adultos que habían recibido al menos una dosis y con un 63% de adultos en Filadelfia completamente vacunados, sumado a nuestra recomendación de que las personas usen las mascarillas, podría detener la propagación de este virus. Desafortunadamente, eso no ha sucedido. Como ya mencionó el alcalde, hoy estamos instituyendo nuevas normativas. Necesitamos enfatizar que estas medidas constituyen solo el próximo paso. Estaremos observando los números de cerca y es posible que necesitemos ajustar las medidas de seguridad si las cifras continúan aumentando. Primero, estamos ordenando el uso obligatorio de mascarillas en Filadelfia a partir de mañana. Eso significa que todos en la ciudad deben usar una mascarilla al ingresar a cualquier negocio o institución, con la excepción de aquellos lugares que exigen vacunas obligatorias para poder ingresar. Los restaurantes y bares deberán exigir mascarillas para todo su personal y sus clientes, excepto cuando las personas estén sentadas comiendo o bebiendo. Si una empresa o institución requiere que todos, incluyendo el personal, estén completamente vacunados antes de ingresar, entonces nadie en ese lugar necesita usar una mascarilla. Debido al alto riesgo del COVID para las personas mayores y las personas más vulnerables a las altas temperaturas, exigimos que se usen mascarillas en los centros de enfriamiento o cooling centers en toda la ciudad. Esta política comenzará a regir hoy al mediodía, mientras que el mandato del uso de las mascarillas en toda la ciudad comenzará esta medianoche. Asimismo, en las reuniones al aire libre, sin asientos, con asistencia de más de 1,000 personas, todos deberán llevar puesta una mascarilla. De acuerdo con esta normativa, los edificios de la ciudad requerirán que todas las personas en áreas públicas utilicen su mascarilla. Este mandato de uso obligatorio de la mascarilla comienza mañana. La segunda norma a la que se refirió el alcalde es nuestro nuevo requisito de vacunación y el uso de mascarillas para los empleados de la ciudad. El 1 de septiembre, todos los nuevos empleados que contrate la ciudad deberán estar completamente vacunados contra el COVID. Se requerirá que los empleados actuales estén completamente vacunados o que se pongan doble mascarilla mientras estén en un espacio cubierto con otras personas. Al decir doble mascarilla, me refiero a que necesitan usar una mascarilla desechable debajo de su mascarilla de tela. Las investigaciones han demostrado que usar 2 mascarillas de esta forma protege casi tanto como una mascarilla N95. Sí, parece molesto, pero afortunadamente hay algo más que usted puede hacer para protegerse, y es vacunarse. Es fácil, es gratis, es seguro y es extremadamente efectivo. Las últimas investigaciones muestran que 1 de 8 personas tiene probabilidad de infectarse con COVID si está completamente vacunado. Igualmente, 1 de 25 personas tiene la probabilidad de terminar en el hospital por COVID si está completamente vacunado. Hay cientos de lugares en toda Filadelfia donde puede ir a vacunarse gratuitamente sin necesidad de mostrar una identificación y de esta manera comenzar a protegerse a sí mismo y a sus seres queridos. Vacunarse es más que solo una decisión personal. Sus consecuencias nos afectan a todos. Según nuestro personal de rastreo de contactos, sabemos que 2/3 de las personas que reportan saber dónde estuvieron expuestas al COVID-19 nos informan que fue debido a un miembro de su hogar o un visitante en su casa. Así es, las personas contraen el COVID en el hogar de alguien que lo trajo a su casa, generalmente un miembro de la familia o un amigo que aún no se había vacunado. Al vacunar a todas las personas elegibles en su hogar, puede ayudar a protegerlas, incluso si son demasiado jóvenes para vacunarse. Antes de acabar, quiero hablar sobre un anuncio más respecto al COVID. Muchos de los anuncios de hoy tienen que ver con su estatus de vacunación. Sabemos que muchas personas han perdido su tarjeta de vacunación o se les ha dañado y están preocupados por las implicaciones que esto podría traer. Por ello, hoy estamos anunciando una forma oficial de solicitar su constancia de vacunación. Este proceso ha llevado tiempo porque no queremos dar información privada sobre su salud a personas inescrupulosas que así lo requieran. Para solicitar su constancia de vacunación, solo necesita llamar a nuestro centro de llamadas COVID al 215-685-5488, es decir, 215-685-5488, o enviar un correo electrónico a covid@fila.gov. Nuestro personal lo guiará a través del proceso de verificación de su dirección y determinará la forma más rápida de enviarle su constancia. Finalmente, quería decir que las cosas no se ven muy bien en este momento, especialmente en vista de lo que estamos viendo en otros estados. Pero creo que si las personas se vacunan y usan sus mascarillas, podremos mostrarle al resto del país cómo vencer esta nueva ola de la pandemia. No es ningún secreto cómo podemos hacerlo. Visite www.fila.gov/vaccine y busque la clínica de vacunas más cercana y vacúnese. Cuéntele a sus amigos y a sus seres queridos lo fácil que fue vacunarse. Y si ellos o usted tiene preguntas sobre la vacuna, cualquier pregunta, llame a nuestro centro de llamadas al 215-685-5488. Gracias a todos por acompañarnos hoy. Juntos superaremos esta pandemia. Gracias.
Thank you very much, Armando. Next, we will move to questions and answers. Again, reporters are asked to limit their questions to 3 or fewer and ask that you stick with the topic at hand today. If there are any reporters who do not get an opportunity to ask questions, please follow up with us via email and we'll get you an answer. First up, we're going to go to Lauren Make with Channel 10. Lauren, you should be able to unmute now.
Yes, can you hear me okay?
Yep, you're great.
Great, thank you. This is for either Dr. Bedigal or the mayor, but this puts some responsibility on businesses. Are you offering them any help in enforcing this?
I'm not at help in what way? Help with guidance or help with money?
Help with guidance, help with money, help with people. I mean, this is going to require them to either check vaccinations or, again, be the enforcers.
Well,
and
there are
make sure that people are wearing masks.
They have to do that. That's part of running a business in this environment, in this pandemic, is checking to make sure people follow the rules. Number of restaurants have decided already to go with vaccinated persons only. And that seems to be a trend in both restaurants and even in health clubs. So at this point in time, this is what we're asking everyone to do. And if issues come up with a particular business, we'll be happy to give them guidance when they ask.
Okay. Dr. Bedigal, you and I talked about this issue of requiring vaccination a week ago yesterday, when we were talking about the New York City proof of vaccination system. And you said at the time that it's not something that you've been actively discussing. This is a sort of version of that, either a mask mandate or proof of vaccination. When did you start discussing this, and what made the difference that you said now's the time?
Yeah, so the difference, what New York City has put into place is an electronic vaccine pass, akin to, I believe New York State has a similar system. And that's something different from what we're doing. This would be businesses checking vaccine, presumably vaccine cards, the cards that people get when they're vaccinated. So it doesn't require complex technology. It isn't us putting in place a separate pass system from what other counties might do. It's a different kind of approach. Fairly straightforward. You know, it doesn't take fancy electronic equipment to check vaccines at the door if a business decides to do that. We are assuming that the majority of businesses right now will likely go with the mask mandate. And they've done that before and know how to do it. But we did want to, you know, recognizing that some businesses, gyms and restaurants, I think primarily, have already said, we want everybody to be vaccinated here. We wanted to create a carve out for them because, you know, they're doing something very protective for their customers and their staff.
In addition, servers and bartenders and others are used to carding people for age. It's not any different than that.
Specifically then, on the vaccine cards, folks are going to need to have them handy now to go to certain places. What are you recommending in terms of how you keep them, how you carry them, and are you concerned about fakes?
Well, yeah. Good, Doc. I'm sorry.
Yeah. So, I mean, yes, we're concerned about fakes there. But I think that fakes are going to be the minority here. People are really hurting themselves if they do that. In terms of how to keep your card, some people have started laminating theirs, which is probably not a great idea because if at some point, not yet, but if at some point we were to move to boosters, it would be hard to record that. You can get little plastic sleeves that you can put it into to protect it, or you can just keep it in your wallet. I do recommend that if people have a phone, they take a picture of their card because then you have that easily accessible and can show that.
Would that be good enough to show at a restaurant or a business or a grocery store, show a picture of it, or will you have to bring your actual card?
So we're asking businesses that do have a vaccination requirement to have a reasonable system for enforcing that. And, you know, to me, if they're requiring a picture of somebody's vaccine card, that seems like a reasonable system. You know, they could just check the card itself as well.
And I'm sure that everybody on this call today has a driver's license, and we carry that with us every day with no problem.
Well, these are paper and they're not,
Yeah.
you know, they can disintegrate more easily. They're also larger. They don't fit in some wallets, which is why people are wondering how to do it. Okay. Thanks, guys.
Thank you very much, Lauren. Next up, we'll move to Marcus Espinoza from Fox 29. Marcus, you should be able to unmute now.
All right, hey guys, I appreciate the time. 2 questions here. The obvious rebuttal will be, if you're vaccinated, why is that not good enough? If you can always show proof of your vaccination status to go into a business and not have to wear a mask, did that get ruined because of the honor system that was taken advantage of previously, or why is that not an option for folks?
Doc, you want to tackle that?
Sure. Yeah, it's just too challenging for people. You know, I think the honor system clearly hasn't worked. And for a business to keep, you know, take, for example, a gym. You check at the door, this one's vaccinated, this one's not. They have a mask on if they're not vaccinated when they walk in. Are you really going to remember in that gym or in a retail store or some other indoor environment which one showed you a vaccine card when they came in? You're probably not. And it's just very difficult then for the businesses to actually enforce it. Would be very difficult for an inspector who is responding to a complaint to, you know, to have to go to each person and ask their status. And for people coming in who want the reassurance that they're coming into a space where they understand what's going on, I think all or nothing is really what's going to work for them at this point. I mean, just given the number of cases and so on.
And then feedback I'm getting right now, which is pretty quick. People are processing this announcement. Some are like, finally, some are like, oh, here we go again. Do you see a lockdown in the impending future? Is that something folks should be worried or aware of?
Not if everybody acts like a mature adult and does what they're supposed to do. We don't anticipate a lockdown. We didn't anticipate doing this a couple months in July, June and July. We didn't expect to be doing this. But you can see the level of immaturity around the country, even from governors and legislatures. I mean, this is where we are. I mean, thank God this is not World War II, because the level of effort and maturity that was shown in World War II is not being shown here, and we'd be speaking German at this point. So, I mean, people just have to grow up and do what they're supposed to do. It's not difficult because it's free, it's accessible, and you can get a vaccine. This is not a big lift, but it seems that people want to make it so. Doctor, you want to talk about the technical side of that?
I mean, the thing I would add is we really desperately need everybody in the city to get vaccinated who is able to get vaccinated. But the reason we're talking about double masking is we know there's still some people who are unvaccinated. And until or unless they are fully vaccinated, they need to be double masking, because we are continuing to see spread from people who had no intention of giving this to their grandmother or their mother or their child. And the double masking is another tool. And I want to make sure everybody has the tools they need to protect themselves.
And then real quick, so this means for schools, Philly schools, everybody will have to wear masks as well, correct? And then Mayor, your emotion is very clear and transparent. Are you upset and ticked off that you have to be here in this first place to announce this? Is this?
No, I'm not upset with being here with you. I'm upset that people just can't act in the way they're supposed to act and do what's good for everybody. And we're not as bad. Look, we're not as bad here because obviously our situation is not as bad as other states and other states. But it just amazes me that this is the most simple thing to do to keep yourself safe and your family safe and your community safe, and people still refuse to do it and are being encouraged not to do it by people who are supposed to be elected officials and responsible people. It's a shame. So
thank you.
Sorry for my attitude, but it's really annoying.
No, I get it. Thank you.
Thank you very much, Marcus. Next, we will move to Mitch Blocker with Channel 10. Mitch, you should be able to unmute.
Thank you, Jim. Good afternoon. Mayor, I appreciate your sentiment, but I'm curious from a legal standpoint, have you consulted the law department about the legality of requiring vaccinations? And what did they tell you?
For our employees?
Yeah.
We've somewhat negotiated all of this with our employees. And as you saw yesterday, District Council 33 endorsed mandated vaccines. It's a matter of your employment. But we're not going to fire you for not getting vaccinated, but you're going to have to wear a mask. I'm sorry, you have to get vaccinated by a certain date. I'm sorry, I was thinking about the private sector, but our employees will have to be vaccinated. I mean, it's just, and there's many other private sector companies requiring the same thing. And if somebody wants to sue us for trying to keep them alive, then we'll see what the judge has to say.
I realize that you're both trying to slow the Delta variant, but I'm also curious as I listen to you talk, to what extent are you also trying to motivate people who are unvaccinated to get vaccinated just by increasing the hassle of not having the vaccine?
I mean, Doctor, we talked about this, the different kinds of masks before, so if you want to.
Sure. I mean, we're not going to do anything just to hassle people, but, I do hope that double masking, the idea behind double masking is protection. It's not to hassle people. However, it's certainly true for anybody who's been wearing 2 masks, which I lately have been doing myself if I'm out and about. You're more comfortable without a mask on. I mean, I don't think there's any debate about that. So the option in non-public spaces to be able to take your mask off once you get vaccinated, hopefully will motivate a few people. And also just seeing, people are doing this. People are stepping up and getting vaccinated, even people who were doubtful at first. I talked to a woman last night who had been waiting and had just a couple of questions, and now she's going to get her vaccine. I think people who've been on the fence really are going, and maybe this will be one more thing that gets them motivated.
But let's not forget, when we are 77% vaccinated at least 1 dose. I think in the 60s, and correct me if I'm wrong, Doctor, in the 60s with double dose. So we're talking a small group of people creating this inconvenience for everybody else in the city. And the other reason, frankly, is that although we're doing well with our vaccination process, we're an island. I mean, people around us are not doing as well. Not in the immediate region, but around us generally. So I mean, we are doing our best to get people vaccinated, and it's a small group of people causing all this hassle for everybody.
Dr. Benegal, one quick question, if you could. What recommendations do you plan to make to the Board of Health tomorrow concerning additional mandates, possibly?
So, we're still in discussions. One of the things that we've been really trying to do is make sure that we have thought through things fully before we enact them. And we're still in active discussions with stakeholders about exactly what we'll bring to the Board of Health. So, that is a public meeting, and we, based on their discussion, we may make additional announcements, but we're not quite there yet.
Thank you.
Thank you very much, Mitch. Next, we're going to go to Annie McCormick from 6ABC. Annie, thank you very much. Should be able to unmute now.
Hello, thank you. The question about the more than 1,000 people at unseated outdoor events, how is this going to affect, Made in America, any events that we have coming up? And additionally, what's the timeline for now about this in place, this mandate? How long do you expect this to be in place?
How often?
No,
We
how
expect-
long? How
Oh.
long?
As long, I guess, till the health department and Dr. Benegal tell us that the numbers are where they are, we can stop doing it. We're having ongoing discussions with Made in America, and again, at any events outdoors with more than 1,000 participants, all attendees need to be masked. So we're trying to work through our stuff with large outdoor events, including Made in America and sporting events and the like. But Made in America is in Labor Day weekend, so we don't have anything more specific than what you have already.
I mean, are you concerned about that event being like a super spreader situation? Do you think that there's a chance that you could make restrictions in the amount of people that could be able to attend in the coming weeks?
I wake up in the morning worrying about everything. I mean, it's been a year and a half of waking up in the morning and worrying about everything. So yeah, I mean, today we're not talking about gun violence, we're talking about pandemics. So yeah, I mean, am I worried? Yeah, I'm worried about everything. So we'll work our way through it. We'll thoughtfully do it. We'll make the decisions based on what's best for the public. But I can't anticipate exactly what's going to happen 3, 4, 5, 6 weeks away.
There was some criticism last year from a lot of businesses saying that they weren't brought to the table when making a lot of the decisions. Obviously, the businesses aren't the ones to make the decisions. It's the city and the health department for public health. But, this isn't our first rodeo in regards to putting in restrictions. And this time, were they at the table? Were businesses and restaurants?
There's been some discussion with the business community, but I will say in hindsight, if we had followed their lead back a year ago or a year and a half ago, we would be in a much worse situation because they didn't want to close anything. So it wasn't easy to shut down the place. But if we followed some of the advice from the business community, we would have stayed open longer. It had more infections and more death.
And in regards to the comparison about showing the vaccination cards, and you mentioned about how we all have licenses and IDs, how we have those, there again with the vaccination cards, there's so many right now that people are selling that are fake. It's not like licenses have changed over the years, Mayor, like in regards to putting a hologram on them and things of that nature, so people can't use fake IDs.
I can't make people,
and stuff,
I can't stop people from being corrupt. If they want to be corrupt and do that, and if they want to carry a fake ID, probably they're going to get biased. But I don't think I really don't think carrying a card is a big thing to ask. As I referred to World War II, we're not asking anybody to jump out of a plane and land in Normandy. We're just asking them to carry a card, and that's not a hard thing to do.
And just your level of concern about businesses being put in the position of, essentially being a bouncer in a lot of these scenarios. I mean, are there conversations with police now about other incidents that they may have? I'm sure you're anticipating there might be some, issues with this, and people might be angry and whatnot.
Everybody's angry in this country today, seemingly. I think the business community is happy they're going to be open and working with us to stay open and stay safe, as opposed to being closed. And if we don't do anything, the possibility of being closed is a much higher percentage.
If you have another round, James, I have a couple more, but I know other people need to go. So
Thank you very much, Annie. I appreciate it. Next up, I'm going to move to Isabel Sanchez from Telemundo. Isabel, you should be able to unmute.
Hola, ¿qué tal, Armando? ¿Cómo estás? Buenas tardes, buenos días, mejor dicho. Mi primera pregunta entonces sería, ¿este sistema de verificación o de solicitar algún reemplazo para la tarjeta de vacuna solo aplica para aquellos vacunados en Filadelfia? Es decir, si alguien se vacunó en Montgomery County, ¿este sistema no sería válido para ellos o no importa dónde se vacunaron, igual lo pueden usar?
Question. Gracias, Isabel. The question is about the verification system for vaccination records. Does this imply that its registry only contains those that were vaccinated in Philadelphia? For instance, if somebody did get vaccinated in Montgomery County, would that show up?
So the requirement is to check vaccination. And typically that would be done by looking at the vaccination cards. The same cards are issued by vaccination sites across the country. Typically a CDC card, it's about this big. There are a few other types of cards in use, but they wouldn't have to have been vaccinated here. But Isabel, what you're pointing out is part of the difficulty of implementing a vaccination checking system in just a city. We have access to the vaccine records of people vaccinated in Philadelphia, but not people vaccinated in New Jersey or Monaco or so on. So that's part of that electronic verification system that is a challenge unless it happens at a larger jurisdiction level, like the state. But certainly for businesses who want to check vaccination, they can ask for the card. People should have a card or a picture of their card. If they don't, they should contact us and we can get them one.
Obviamente, Isabel, lo que has indicado es el problema que tenemos para verificar el estatus de vacunaciones. La gente puede ver las tarjetas, pero las tarjetas son iguales en casi todos los lugares alrededor del país, o una tarjeta estándar que dan los centros de control de enfermedades, aunque hay otros tipos de tarjetas. Pero aquí viene la dificultad, que no tenemos una manera de implementar este sistema fuera de la ciudad. El acceso lo pueden tener los negocios, obviamente, para las personas que están registradas en Filadelfia, pero no va a poder verse si están vacunadas en New Jersey o si se vacunaron en el condado de Montgomery. El sistema electrónico a la larga va a ser la mejor manera de poder hacerlo cuando se adopte en una jurisdicción más grande alrededor del país. Por el momento, lo que puede hacer la persona es llevar la tarjeta en su teléfono o consigo para poder mostrarla. Y por supuesto, los negocios pueden contactarnos para verificar el estatus de una persona. Gracias.
Gracias, Armando. Mi segunda pregunta, algo que ya hablaron, pero me gustaría tenerlo en español para la comunidad hispana, es básicamente el año pasado negocios pequeños como las bodegas lidiaron con muchos problemas al momento de verificar o obligar que la gente usara la mascarilla. Este año va a ser un poquito más difícil, incluyendo si tienen que verificar con la tarjeta de lo que sería la inmunización. ¿Algún consejo, alguna ayuda, algún departamento de la ciudad que ellos podrían accesar para recibir any kind of guidance, de guías o de ayuda para cómo manejar mejor estas situaciones? Y si se le colocaría una multa al negocio en caso de que no sigan con estos lineamientos.
Gracias, Isabel. Commissioner, this is a two-part question. The first of all, to say that this has already been touched upon, but this is of necessity for the Hispanic community that's listening to us. Last year, there was problems with small businesses, especially bodegas, in having to verify that people wear masks before entering their businesses. Now we assume it's going to be harder for them to verify the status of vaccination through the cards. Is there any advice or any help that you could give those business owners as to how to proceed in this regard? And also, is there any site where they can find guidance or any guide that they can follow? And finally, the second part of the second question is, will there be a fine for those businesses that don't enforce this?
So it's important to keep in mind that checking vaccination status is an option for businesses that want to not have to require masks. So if they want to require everybody to be vaccinated, then they would not have to require masks. If they are not requiring everybody who enters to be vaccinated, which is probably going to be the case for many bodegas, then they simply need to ask or to require everybody to be masked. So they wouldn't then have to verify vaccine status. We will be posting some kind of a cheat sheet, basically how to check a vaccine card for the businesses that do want to do a vaccine requirement, and we can make sure that that is available in Spanish. And in terms of fines, if people are violating the COVID safety requirements, there can be fines. associated with those violations.
Isabel, es importante tener en cuenta de que es una opción al verificar el estatus de vacunación de un potencial cliente que entre a una bodega o a un negocio, porque aquellos que no lo hacen tienen la opción de requerir que todas las personas que ingresen en el local lleven puestas sus mascarillas, especialmente una mascarilla doble. Si no, pueden verificarlo o no quieren hacerlo o les resulta difícil, pueden exigir que todos sus clientes puedan llevar mascarillas para poder recibir servicio. Nosotros vamos a poner material informativo disponible, una hoja cheat sheet o una hoja con resumen de pautas de cómo hacer esto, y también lo vamos a tener en español. En cuanto a las multas, el violar las restricciones o las indicaciones de las pautas que pone la ciudad posiblemente pudiera conllevar una multa más adelante, pero no por el momento. Gracias.
Armando, gracias a ti. Última pregunta, solo para clarificar. Estos requerimientos de mascarillas en eventos de más de 1,000 personas también aplica para eventos deportivos como los Juegos de los Phillies, en interiores, en exteriores, en todo eso, ¿verdad?
This is just one final question to clarify the requirement of wearing masks in gatherings of up to or over 1,000 people. Does it include sports events?
So the requirement is for non-seated events. So like a concert where there's a mosh pit and everybody's just jammed together near the stage, people really need to be masked. If they're at a sports game and they're seated, they wouldn't have to be masked there, outside.
Este requisito, Isabel, se requiere para las personas que estén en espacios donde no estén sentados, más de 1,000 personas. Un ejemplo típico sería un concierto en el cual hay un mosh pit y todas las personas están aglomeradas, en cuyo caso necesitarían llevar puesta la mascarilla. Pero para los eventos deportivos donde están sentados, no todavía.
Mil gracias, Armando, muy amable.
Bueno, muchas gracias.
Thank you very much, Isabel. Next, we're going to go to Kennedy Rose from the Philadelphia Business Journal. Go ahead, Kennedy.
Hi, everybody. Dr. Bedigal, my first question is for you. I was wondering, why allow restaurants that require vaccinations to not require masks, especially when there are concerns about the Delta variant spreading between vaccinated people?
So I am going to stress that this is a first step, and we're hoping that this brings us enough safety that we can get control of this surge and not have to do more. Our case count is definitely up from where it was a month ago, but we're still shy of 200. So we're not nearly at the levels that we were at the worst part of the pandemic. What we're trying to do is to put in place safety measures now to control the rise, bring it back down again. So we're hoping that we will be able to keep restaurants open if people can remain masked, except when they're seated and actively eating and drinking, putting that mask right back on after they've eaten. We will see what happens with the numbers and how people do. And of course, many people may continue to choose to eat at the outside tables that have sprouted up all over our city. I think restaurants have been doing a really good job at, putting outside seating up, at takeout, at trying to make their restaurants as safe as possible for people. So that's where we are today.
Okay. And my second question also for you, I was wondering, what sort of benchmarks would the city need to hit in terms of a decline in cases to lift that mask mandate again?
So, we've talked about this a few times. We don't look at one single metric. We look at the picture altogether. So we look at the number of cases, especially the average daily cases. We look at hospitalizations. We look at the percent positivity. We also look at what's happening around us. And, when we're looking at what essentially looks like a raging forest fire in some parts of the South, that's concerning, especially when you see places like Austin, Texas, which has a high vaccination rate, but is surrounded by the rest of Texas, and their hospitals are filling up. So we look at all those things together. So I can't give you one single benchmark. But, I think when we start to see cases going down, our vaccination rate has risen considerably, and those things will go together. If we can get the vaccination rate up high enough, cases will go down. When we start to see that happening, positivity is coming down, hospitalizations are coming down, that's when we would be ready to do that.
Okay, thanks very much. That's all I had.
Thank you very much, Kennedy. Next, we're going to move to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi. I'm wondering what the exception for businesses that require a vaccination, proof of vaccination means for kids. You know, can parents who are vaccinated take a kid under 12 into a restaurant or place that requires vaccination?
So this is a really common question I hear all the time. I hear this at home too. It's important to remember that we're talking about infection risk and not morals. We may get really outraged by the people who refuse to get vaccinated, but for a business, it's about whether somebody's vaccinated or not whether they should be vaccinated or could be vaccinated. So if you're letting unvaccinated people in, then that's not a true vaccine mandate. So, you know, for a restaurant that wants to have a vaccine mandate and wants to cater to families, outdoor seating would be great for that. But if they are letting unvaccinated people in, then that means people aren't protected. So, you know, I think it's a difficult question for us all right now because it's so frustrating that there's been so much anti-vaccine sentiment when it's such a miracle that we have these vaccines. But this particular point isn't really about that.
Okay, so to clarify, a place that is requiring everyone be vaccinated would exclude children from entering.
Children who are too young to be vaccinated. Hopefully that will change soon and kids will be able to get vaccinated, but for now.
Okay, and for enforcement of this, you know, would businesses that choose to require vaccination need to register with the city or let you all know in any way that that's what they're doing? Like, how will you know whether someone's enforcing a mask mandate or checking?
So if they're enforcing a mask mandate, it should be obvious at the entrance. So, you know, our enforcement is generally complaint driven. If our inspectors arrive at a place that says it has a vaccine mandate, or, you know, that people are complaining that there is a vaccine mandate, but they aren't following it, and we don't see somebody checking, we don't see, presumably they would want a sign, you know, we would look for signs that they're enforcing.
Okay. And I know you talked about the metrics that are concerning that led to this decision. Could you, Dr. Bedigal, just share in a little more detail, like where some of those metrics are now and why that was concerning?
Sure. So our average daily cases as of this morning is at 181. We were in the low 20s in early July. So, you know, we've increased. I think I talked about this a week ago that we had doubled in a week between July 12th and the 19th. We doubled again in about 10 days. Following that, we doubled in 12 days. So the rate of increase is slowing down, but still very substantial. We are over 100 hospitalizations currently in the city, where we were down as low as 48. I believe we have 13 people now in ICUs. I may be off by one or two there. So, you know, really a relative increase that's quite substantial, more than doubling our hospitalizations. Our hospitals are not overrun the way they are in the South, but, you know, when we think about rates of increase, we think about doubling time. That's very concerning. And our positivity rate has gone from 1% to 5%. So again, in the scale of things, 5% is relatively low. But, you know, 5 times higher than it was a month ago is deeply concerning.
Thank you.
Thank you very much, Laura. Just want to give everybody an update on timing. We have about 11 minutes left, so try to keep your questions and answers short if possible. Next, we're going to move to Mike D'Onofrio from the Philly Tribune. Go ahead, Mike. Mike, you should be able to unmute.
Okay, I think I got it. Can someone please detail the exact penalties for businesses and citizens for not complying with these new mandates? And do they include actually closing a business down?
Doctor, I'm not sure the exact, I don't have the penalty menu in front of me.
Yeah, I think we have to get back to you on that. I don't have the exact fine. The penalties typically are for a business that's not enforcing rather than for individual citizens.
All right. And do you, I guess, Mayor, do you expect these new mandates to negatively affect city businesses at all? You know, cause people to maybe stop going out to restaurants?
No, I think it gives them the opportunity to go out to restaurants under the proper safety precautions. I think that it's much more preferable than doing nothing and waiting till it gets really, really bad and then have to shut down things. I think this is a nuanced approach that makes a lot of sense for a lot of businesses, and they will be able to make decisions on their own as to the direction of their business, whether they want to go fully vaccine or masked or outdoors or how many people they bring back into the office. All those kinds of decisions they're able to make within the confines of these restrictions. So I think we're approaching it in an appropriate, metered way without waiting till the sword of Damocles falls and then we have to go back to where we were back in March of 2020.
All right, maybe just lastly, Commissioner, do you expect this cycle of tightening and loosening of pandemic restrictions just to continue for the foreseeable future?
Really depends what happens with vaccinations. If we can vaccinate our whole city, we should be able to break free of this cycle.
All right, that's all I got. Thanks.
Thank you very much, Mike. Next, we're going to go to Matthew Rothstein from BizNow. Go ahead, Matt.
Hi, thank you. So one of the defining features of the restrictions last year was, in terms of capacity and social distancing. Why is that not a part of the increased restrictions this year? And is there what thought has been given to perhaps re-implementing capacity restrictions on indoor spaces?
So we have a weapon now we didn't have last year. We have very effective vaccines and they are readily available and they are free. So when we looked at this and said we need to do something, we also knew that capacity limits and closures and that sort of thing is a huge economic hit to our city. Masks and vaccination mandates are not. So that's why we went in this direction. Again, we're going to have to watch the numbers and see if this works. But we are trying not to hurt our city economically at a time that it's just starting to recover.
Right. So there's no basis. There's no basis in terms of the different science of transmission with regards to the Delta variant.
Masks are very effective. Double masking is even more effective. In terms of distancing, there's a little bit less emphasis in the science now on distancing, in part because we know more about airborne spread. So, this is very much science-based, but it is also something, how to put this? Capacity limits do lower risk in the sense that, of 100 people, if 5% have COVID, 100 people will contain approximately on average 5 people with COVID, 50 people on average 2.5. So your chances are less of being next to somebody, but masks could be much more effective than that.
Okay, thank you.
Thank you very much, Matthew. Next, we're going to move to David Melander with Philly Sports Network. Go ahead, David.
I just want to follow up from what I've been hearing so far is that the mask mandate go for anybody's going to Citizens Bank Park or Lincoln Financial Field for the Eagles preseason games?
In the indoor spaces.
Okay, and have you had a chance to talk to, like, say, the Wells Fargo Center about those upcoming concerts that they're going to be having? How are they going to be enforcing that?
I believe those conversations are at least.
The managing director's been in conversation with the indoor spaces, and we'd have to get back to you on exactly what the status is.
Okay, so as of right now, there are no plans to have this for like outdoor events, like for Eagles or Phillies games?
At the moment, unless Doc, you want to correct me, at the moment, no.
At the moment, no. Great.
All right, thank you.
Wonderful. Thank you very much, David. Next, we're going to move to Corey Clark from PCN. Go ahead, Corey.
Yes, just a couple quick ones. First of all, Doctor, what do you think about treating a confirmed infection or natural infection?
Oh, Corey, I think you muted yourself. Let's try that again.
You're muted.
I did, sorry. Yes, a confirmed infection or natural infection, the same as a vaccination. There are some businesses that are doing this, some restaurants that are doing this.
Yeah, the science does not support that. Vaccination is just a much more effective preventive than natural infection. People do have a little bit of immunity from natural infection, but it does not prevent them from getting infected again. So anybody who's had COVID, all the more reason to get vaccinated.
And just finally, can you talk about the African American population in the city and the vaccination rate, and what can you do to get that number up and get past that hesitancy?
Yeah, so we've been working hard to reach the African American population of the city to make sure vaccines are convenient, to talk with people and try to understand reasons people have put off getting vaccinated. You know, I think there's a lot of discussion about anti-vax sentiment coming from the right wing. I don't think that's what we're looking at here in Philadelphia at all. I think this is a healthcare industry that, or, you know, the healthcare institutions in our country haven't necessarily built a history of trust with the Black community. And I think that's what we're looking at here. So we are working with community partners, trusted ambassadors, to talk to people door to door, to set up clinics in people's neighborhoods. Numbers are going up, but they're going up slowly. You know, over the last 6 to 8 weeks, the largest number of people vaccinated in the city have been Black. So, you know, we're making some progress, but we need to go faster. And the group we particularly need to reach most is young adults. So the young Black adults have the lowest vaccination rate in the city. It's only around 31%. We're hoping that this combination of vaccine mandates, masking will help to encourage that, and that people will at least see the double masking as another strategy they can use to protect the people in their lives if they're not vaccinated yet.
Thank you. That's it.
Thank you very much, Corey. We're going to go to a quick second round. Annie, if you've got 1 or 2 questions, make it quick. And then I do have, if we can squeeze in Sean Walsh at the end. Annie, go ahead.
I just want a quick clarification on the sporting events. Maybe I just totally misunderstood, but for example, Sixers Flyers at the Wells Fargo, they need to wear a mask indoors or show proof of vaccination.
So indoors, people are required to mask. Proof of vaccination only applies if you have a vaccine policy in place that requires everybody to be vaccinated.
Okay, so then if you're going to a sporting event inside the Wells Fargo Center, you need to follow the Wells Fargo Center policy if they do have one to show proof of vaccination, or you must wear a mask.
I mean, I have not seen the Wells Fargo policy. We were just making this announcement now, so I don't want to speak to what their policy is today. But in general, at any indoor event, unless there's a vaccine mandate in place, people would have to be masked.
Well, if they're requiring 17,000 people to be vaccinated and be able to prove it, then there won't be a mask mandate. But if that's probably unlikely, so there'll probably be a mask requirement.
Okay.
Great. Thank you very much, Annie. Sean, did you have a question?
Yes, thanks. Mayor, on employee vaccination, the DC 33 yesterday, like you mentioned, indicated that they would not oppose, a full vax mandate with exceptions for specific reasons. Why not go that far? Why are you stopping short of that if the city's biggest union is?
But I'm stopping short of what?
What you guys are doing is allowing people who are unvaccinated to come in with a mask as opposed to just requiring everyone to be vaccinated.
No, I believe, Doctor, you could correct me if I'm wrong. We're requiring our employees to be masked, correct? I mean, to be vaccinated.
We are, but there is an out for people to be double masked. That's correct.
So why not go, that's one step further for everyone.
Because I can't physically drag them to a vaccination center and hold their arm while they vaccinate them. I mean, there's day-to-day practicality that folks won't be. We're going to try this, see how it works, and move from there. I mean, I'm not going to go in a case-by-case situation. What if this person decides they don't? I mean, I don't have an answer for every possible scenario.
Thanks. And Dr. Bedigal, on the same issue, was testing as opposed to masking a consideration for the unvaccinated city employees?
We talked about several other scenarios, one of which would be testing. We had concerns about the availability of testing in a surge and using up that capacity for routine surveillance testing, as well as having to give people time off work for testing and inadvertently incentivizing people to stay unvaccinated. So because double masking would be at least as protective, we decided to go with that option.
And testing is only a snapshot in time, correct, doctor?
That is correct.
Thanks. And lastly, what % of the city workforce is vaccinated?
We do not have an exact number on that. Our data folks are working on that right now.
All right. Seeing as we have now passed the 11:30 mark, I wanted to thank everyone for their time today. We will announce next week's briefing by Twitter and Media Advisory when a time and date are set. Thank you all very much for coming and for covering today's briefing.